A few teams slumping out west, including the Dodgers.
CNN breaking news.
Well, Los Angeles looking pretty good right now.
I'm worried about my mom and my dad. I mean that with every ounce of my being.
Tonight, a special report on America's nursing, rehabilitation, and assisted living community.
I will stand with you and fight for you.
Knowing that a battle was before them in 2010.
To me, 2010 has represented a year of tremendous challenges.
They faced Washington's biggest issue, healthcare reform.
We had a lot of cuts from Medicare passed with the law back in February.
So to stand up for America's seniors and disabled,
if we're not a player at the table, then we don't get our voice heard.
They renewed their focus and took their fight to the front lines.
You'll hear us talking more about our patients instead of payments.
Nursing assistants are the closest link to the residents. They provide over 90% of the direct care.
Quality is what long-term care has to be about, not about reimbursement.
I am in this because this is my passion. This is what I like. This is what I know how to do.
This is a special report, AHCA NCAL, on the front lines. From the first days of the 111th Congress, AHCA NCAL was engaging with lawmakers on issues that matter most to the long-term care profession. From Medicaid to arbitration, and from workforce to survey, they were successful in influencing members of Congress on both sides of the aisle. In 2010, AHCA NCAL experienced the largest grassroots turnout in the association's history.
We've had over 300,000 calls, emails, and letters sent to Capitol Hill and members of Congress.
In this report, we'll see how AHCA NCAL translated grassroots into advocacy and action.
Our residents and patients and the very viability of this facility and facilities throughout Florida and the nation at large are dependent upon Congress passing the emergency Medicaid extension.
What is going on with Congress is that they have already made $27 billion in reductions to Medicare in just the past 9 months.
With all of the challenges in front of us this past year, we brought back the Driving for Quality Care campaign, which has been a tremendous teamwork success.
Driving for Quality Care traveled more than 15,000 miles, visited 40 states, and held events in more than 60 congressional districts, reaching 8 million American households.
The RV tours have enabled family members to come out and talk about how much they appreciate the care that's being delivered for their parents, and actual residents who have rolled up in wheelchairs and had the opportunity to just say what it's meant to them and how this is their home.
My mother was a resident here. It feels odd to call it a facility because it really did become her home.
Pakistan tonight. These are desperate hours for millions in the flood zone, but they are surviving.
2010 was crowded with groundbreaking news on many fronts.
Unfolding in Haiti. This was just over 3 hours.
Igniting a fire and launching a day-long search for 11 workers.
The water was rising.
It was the voices of patients and caregivers on the front lines that helped AHCA NCAL break through to get their message heard.
This is ABC 40 News.
One group is taking its fight for nursing homes.
The Driving for Quality Care RV
passage of the bill.
An RV tour is crisscrossing the country to drum up support for quality senior care.
Those behind the Driving for Quality Care campaign say it's off to a great start.
A $472 million extension of Medicaid relief is making its way through Congress right now, and Tennessee seniors want their representatives to support it.
After a federal victory, AHCA and NCAL took their fight to governors and state legislators to ensure their support for the elderly and disabled.
It's great that the first step has taken place and Washington has pushed those funds in our direction. Now it's up to our state legislature, up to our state leadership to do the right thing.
My grandmother never asked anyone for anything, but today she needs the care that she deserves. So on behalf of her, I'm here to fight. Thank you very much.
Through Driving for Quality Care and other efforts, including their largest congressional briefing to date, AHCA NCAL was able to effectively educate and gain support of members of Congress. Their constant presence on the Hill allowed their messages to resonate with those that mattered most.
Your voices were heard loud and clear on Capitol Hill.
As a society, it is our obligation and our responsibility to help those that have given this country so much and are now looking to us to give them a helping hand.
We should ensure that increases in FMAP funding continue to keep pace with our economy, because if we don't, we're likely to let people in need of assistance slip through the cracks.
I'm worried about my mom and my dad. Someday, God willing, if they live long enough, they're probably going to need some help.
We've got to break some of the bad habits and ensure that any federal expenditures that we send to the states get to you and get to the people that it's intended to benefit.
When we come back, what's ahead for AHCA and NCAL? AHCA NCAL recognizes that the battle continues.
We must seek to achieve for our patients all the resources that they need to provide high-quality care. Quality will remain our central theme.
But through their high visibility in 2010, and with the strong relationships on Capitol Hill,
we are the economic backbone of America, and we need to be treated better and more fairly going forward.
And renewed efforts to deliver their message from the front lines of care.
When you think about the folks who live in nursing homes in Texas and across the nation, when they were younger, they were there for us. It's time for us to be there for them.
They are prepared for new challenges in 2011.
I have seen many changes in our profession, and one of the things that has always been a constant is the resiliency of our members. We are, as a profession, in my opinion, the most efficient and the most effective healthcare providers in the continuum.